So already Dr. Professor Associate Professor Mainul Bhai already gave introduction about me, but I want to tell you some things about me. I have completed my Bachelor of Medicine and Surgery from Sir Solimullah Medical College on 2009 and completed my fellowship in hematology on 2016 January. Then I went for a clinical fellowship on bone marrow transplant in Singapore National University Hospital, and I got a scholarship from NUH and completed the whole process there. After came back from Singapore after COVID, I joined United Hospital Dhaka, and 2 years after joining United Hospital, I started bone marrow transplant in that hospital. So why we took 2 years? I want to give you that introduction. Actually, I faced some obstacles, and all of you know bone marrow transplant is a very highly um, sophisticated medical procedure. So it's not an easy thing to start bone marrow transplant in a hospital which is JCI accredited. So all of you know the JCI. In our country, only 2 hospitals are JCI accredited. As the second JCI accredited hospital, we have to maintain all quality to ensure the patient safety. You cannot do what you like because we have some obligations. So I want to share with you my experience in last 3 years. So the major challenges for bone marrow transplant in a developing country we face, the number one actually the lack of skilled manpower. You know, we have only 150 plus hematologist in our adult hematologist in our country. So among them, a few bone marrow transplant physicians are there, and this is the number one challenge to start bone marrow transplant program. Because of lack of skilled manpower, a program can be failed. There are other challenges. The second important challenge is, the limited fund. I will show you how we overcome these challenges in our hospital. And the number three things I will tell from my experience, that to explain someone about bone marrow transplant who doesn't know anything about actually hematology, anything about bone marrow transplant. So always people ask about that. Maybe it is like, a medical procedure just like other things, but it's a huge, highly technical, time consuming and burden for an institution. So how we overcome that problem in our hospital? So I planned a stepwise program in our hospital. So that was actually two-step program. In the very beginning, I explained to my hospital that because of JCI hospital, we have to maintain some guidelines. So we follow WBMT guidelines. So all of you know worldwide network of blood and bone marrow transplantation. They have some guidelines for to start bone marrow transplant in developing countries, and they divided that requirements into absolute minimum, preferred, and ideal requirements. So to reduce the financial burden to the new transplant program and lack of recruit less patients in a new center, we started our program with these facilities. So I want to share you that facilities with you. So we established 2 bone marrow a dedicated room for our bone marrow transplant, and that 2 room was built with positive pressure and HEPA filtration. That was the most challenging and most expensive one, because without positive pressure and without HEPA filter, you should not undergo bone marrow transplant, especially allogenic transplant, as per WBMT requirement. And in the meantime, simultaneously, we develop a doctor's team which includes specialists. We have one specialist in hematology, and we have specialists who are, they did their post graduation in medicine, internal medicine. So we have a doctor's pool for a bone marrow transplant, and we have a dedicated nursing team for the bone marrow transplant. We in our hospital we have apheresis team, but to again to reduce the burden from financial burden from hospital, we recruit them from our blood bank, so that they can run simultaneously the stem cell apheresis and platelet apheresis. So we don't need to recruit more people for this new program. And we have, as all of you know, United Hospital has a very dedicated and a very good radiation oncology center. We have all facilities like irradiated blood products, total body irradiation, everything we have in our hospital. And from laboratory support, we have a very good, because we already got JCI accredited accreditation. Because of that, we have that minimum requirements for bone marrow transplant from our laboratory, and we have multidisciplinary team support, including ICU, pulmonary, and emergency services, which are essential to start bone marrow transplant program in a hospital. And we have also interventional radiology support. That is a very wonderful team in our hospital, because all of you know, without any intensivist for line insertion, we cannot go for bone marrow transplant. So these are the actually minimal requirements from WBMT. And I want to tell you that WBMT, they don't tell that you have to store your stem cell or bone marrow initially. You can go for bone marrow transplant without cryopreservation also. Their requirements for the cryopreservation is under the ideal requirements. So this is our bone marrow transplant room, and I want to show you the apheresis machine, that is the Comtech machine. I'm sure all of you you are aware about apheresis, platelet apheresis, and we are collecting stem cell from this the same machine we are using for the platelet apheresis and stem cell apheresis. So WBMT, they showed that you can go for bone marrow transplant without cryopreservation, and there are evidences that you can store your stem cells until 6 days without cryopreservation, and you can infuse your patient like lymphoma patient. You know that lymphoma patient needs beam, high dose chemotherapy, and beam you can give along the 4 to 5 days. Then you can infuse after 6 days your stem cells to the patient. So cryopreservation is not a barrier to start a bone marrow transplant program in a new hospital. So you can go with that, and there are evidence, and WBMT is supported in developing countries to start program for this. These are the two data. They showed that you can continue your bone marrow transplant program initially, but later you have to of course you have to develop the whole program. So another problem we have faced in our hospital after developing our infrastructure, after developing our doctors and nursing team, we faced a big challenge from this side. That is the local healthcare policy. So I want to inform you that in Bangladesh there is an Organ Transplantation Act, and they include bone marrow as well as stem cell actually in that law. So according to that law, if you want to start bone marrow transplant in a private hospital, you have to and you must take permission from Bangladesh government. And without government permission, if you start transplant, any kind of transplant in a private hospital, the hospital license can be cancelled. So when our authority informed us that you cannot go for that, then we apply for the bone marrow transplant permission to the government, and that is the that is the law I showed you, that they made this law. This is the 1999 transplant law in Bengali. So we applied for the government permission for United Hospital on April 2022, and after a long time, almost 1.5 years, we got that permission on September 2023. Actually, we have to wait for a long time for these things. Our transplant, our infrastructure was ready. We were ready to start transplant. Our patient actually ready, but we could not be able to start transplant because of that. And last year we got this permission from Bangladesh government. So now I want to tell you that after facing these types of obstacles like lack of the manpower, we have to develop some things. We have to develop infrastructure support. Then we have to overcome the local healthcare problems. Then we started transplant. On 2023 October, we have started bone marrow transplant in United Hospital, and we have started with autologous bone marrow transplant. So far we have done 6 bone marrow transplant in our hospital, 5 autologous and allogenic. We have started allogenic bone marrow transplant 1 year after starting autologous bone marrow transplant, that is last 2nd October. So I want to give you a brief description of our patient. So we have 3 lymphoma patient for autologous and 1 germ cell tumor patient for autologous, and the allogenic case was relapse AML. So I want to give you the short introduction for the transplant patient. For the first lymphoma patient, it was a relapse refractory lymphoma. and he got only high dose melphalan because it was the first case. We did not take that risk because of the, that we did not have cryopreservation. So we gave him high dose melphalan, and he engrafted day plus 11. His peri-transplant period was uneventful, but unluckily, actually, he died 3 months after transplant for COVID pneumonia. And I want to mention that one of our important patient for the pediatric people here, but they are here. For the germ cell tumor, you can go for bone marrow transplant, and for the germ cell tumor, 3 transplant should be needed, 3 autologous transplant. And our patient, 16 years old girl, I did tandem transplant for her for this germ cell tumor within 6 months, and she is, she's in complete remission in PET CT scan, and her markers is also in remission. And we also started allogenic bone marrow transplant last October this year, and she is still in she's a very good condition without GVHD, and she achieved donor chimerism also, 100% donor chimerism on day 32. So this is our first autologous patient. The first picture is the stem cell collection, and the second one is stem cell infusion. This is the first allogenic bone marrow transplant this year, October 2024. So I already gave you that bone marrow transplant. You can start. No, you don't need to think about much about that. This is a financial burden or any other thing. You just need a skilled manpower and a beautiful plan. So you can use your own resources and start this program in your hospital by judicial thinking and appropriate use of the manpower and the resources. So developing countries, there is no point to tell like that we have that burden, we have that problem. We can overcome this problem, and WBMT guideline of requirements is really helpful to overcome this burden. So as a JCI accredited hospital, I was able to explain my authority that yes, with fulfilling all the standard criteria, we can start bone marrow transplant, and without giving much or huge financial burden to hospital, you can do that also. And we have shown that we have already successfully done 5 autologous and 1 allogenic transplant without any peri-transplant mortality. Thank you so much. Thank you.